issues are extremely prevalent in all settings of the healthcare environment. The mental status examination is a structured assessment of the patient's behavioral and cognitive functioning. The purpose of a mental status examination is to assess the presence and extent of a person's mental impairment. Using the mental status examination makes interviewing patients with mental health issues more structured and helps when gathering information to chart. The mental status exam is used by nurses, physicians, and students when trying to formulate a complete psychiatric assessment of a client. This video includes the components of the mental status exam with some examples. The first component of the exam is the patient's level of consciousness. Is the patient awake and aware of their surroundings, or are they hard to rouse, drowsy, in a coma? Are they oriented to person, place, and time? The next component is the patient's general appearance. For instance, how does the patient look in accordance with their age? Are they well groomed? How is their posture? Can they keep eye contact? Are they wearing excessive jewelry and makeup? So Tiffany, what do you like to do for fun?
Well, sometimes I go to the bar, and then other times I ride my BMX around and then skateboard on top of my BMX, and then I jump out of a window and then chase a cat a block down the road.
Next, how is the patient's speech? Slow, fast? Do they speak loudly, soft? Is it slurred or pressured? Also, what is their motor activity like? Are they lethargic, tense, rigid? Do they have tremors? How is their mood and affect? Mood being their stated emotions and affect being their outward appearance. These can be very different. Hi Tiffany, how are you feeling today?
I'm feeling fine.
Yeah?
Yeah.
In addition, do they have any abnormal perceptions? For instance, any abnormal experiences of the five senses? Are they hearing voices, seeing things? What is their thought content? For instance, what are they talking about? Are they delusional, obsessed with something, have a phobia? Next, what is their attitude and insight like? How do they act towards you? Are they cooperative or not? Do they understand what is going on? Do they know anything about their illness? What triggers them? What do they want out of the treatment? Do you know what your triggers are with your depression?
Actually, I find that I get a lot more sad during the winter.
In addition, do they have problems with memory? Any memory loss, recent, immediate, or long-term? Is this patient able to make good judgments? Are they spending all their money or partaking in unsafe activities?
Tiffany, get down! That's really unsafe!
And does this patient have destructive potential to themselves or to others? Do they have a plan? And do you think they will act on their thoughts? Finally, one could examine intelligence. This is not always recommended because many people make assumptions with limited information. One could examine if the patient could do basic math skills, categorize objects, ask them what kind of education they have. However, this should be left to an expert. These are just some examples of what to ask for the various components. One may need to ask different questions depending on the patient and their disorder. Some of these questions may seem awkward to ask because they are not commonly asked in many healthcare settings. However, much of this information can be gathered by just having a simple conversation with one's client as long as you are paying close attention to what they are saying. As well, one should keep in mind that technique develops over time and that not all of this information needs to be gathered during one sitting.